another episode of Voices of Inclusive Research podcast. I'm Dr. Rand, your host, founder of Diverse Research Now. And today we're here to hear the voice of Mr. Justin Campbell. Justin is a local San Diegan who is a user experience designer and a health and wellness coach with a deep-rooted belief in the power of self-mastery, discipline, and a growth mindset to help people achieve holistic well-being. So, hi Justin, how are you?
How's it going?
Good. I'm so happy that you could be here today. And so we would love to hear your story and why you do the work that you do.
Yeah. So I've always been interested in people, what makes them tick, how they work. When I was really little, my mom bought me this book to explain how cows digest food because I'm very curious and I wouldn't stop asking her questions. She told me that cows digest their food 4 times and I just kept asking her over and over again. So I've always been curious. And for my work in my very early career, I started off doing strictly design work, like artwork. But I always found myself asking people questions about, why do you need this design? Why do you need this created? How will it help you? So a long time ago in my career, I switched over to doing user experience design, which is interviewing people, seeing what they need, and then designing stuff for them. And then also, similar with health and mindset coaching, I have a lot of friends. We always end up talking about optimizing our lives, living our best life, really trying to live with purpose.
Yeah.
And we kind of started forming accountability groups because of that. And then people were asking me questions about, how do they achieve their goals? So then I started doing coaching after some of those conversations.
Okay, and these accountability groups were focused on health?
So we started with what's your life purpose, like trying to understand what your life purpose is. And then based on that, how do you optimize your life to reach that purpose? So even if your life purpose isn't specifically around health, you need energy to go towards your life purpose. No. So you have to be healthy in order to achieve whatever it is.
That's right. That's right. It's so important. So I love that. So how long have you been doing this health and mindset coaching?
Yeah, I've been doing accountability for a pretty long time, at least 3-4 years. I started doing official coaching recently this year.
Well, congratulations. Yeah. Awesome. So you'll have to share all your information so everyone can find you. And tell me, what do you get out of the health and mindset coaching? Like, what is your reward as you help others?
Yeah. The biggest thing I just think about is overall life purpose. It's not like a meaningful life if what you're doing isn't in support of others, just in general, kind of like a foundational rule. So I'm already interested in health and fitness. I just always have been. Mm-hmm. And then helping people achieve their goals with whether it be health or finding a life purpose. It just brings a sense that I'm helping the community become better. So yeah.
Love that. Love that. So I think that's how we kind of connected. So me and Justin, we met at Black Tech Link. Want to shout them out. I was just at an event last night with them. They had a Christmas party.
Okay, yeah, actually.
We met at their event this summer, right? This summer. And me and Justin kind of sparked up a conversation about health, of course, and specifically research, because Diverse Research Now is all about getting the community involved in research. But first, we want to educate on health. So that's the reason why we kind of connected. And so we set up a time for Justin to come share more. And at that event, we talked more about research. And I don't remember exactly what you were saying, but where do you think research fits in when it comes to health?
Yeah, I think what we were talking about, if I remember correctly, was like health recommendations that you hear like whatever on the news, on headlines, just like general common stuff, eat your vegetables, all that stuff. We were talking about, I think, the fact that a lot of the studies that are being cited or used to give general health information, they didn't test on people of color. Mm-hmm. So like you may be getting recommendations that might not be helpful for you. Similar as well with women, a lot of large tests until recently were mainly done on men just because they found it easier to do testing on men.
Yep.
They didn't want to account for people's cycles and stuff. So sometimes there'll be like general health advice.
Wow.
But it's like if you're not a woman.
Wait a minute. Because, wait a minute, say that again. Because I didn't think that might be the reason.
Yeah.
Because they didn't want to account for women's cycles.
Yeah. Yeah. So there's, I don't know the specific studies, but I just know that in general, especially the farther back you go, they use health studies to make general recommendations about, how long you should sleep, if you should do cold exposure, all this stuff. But a lot of those tests are done on men only.
And white men at that.
Yeah, exactly.
So, yes, we know that now. I think That has definitely come out in the research world, and which is why we need this diverse data now. Like, we need more groups of color involved in the research, because we have realized that most of the research has been done on white men.
Yeah.
So, which is a problem, because we're finding that their genetics are different, environment is different. It all goes into account of creating these drugs that are supposed to help everybody.
Yeah, definitely. I think in an ideal future, maybe we'll be able to have individualized, like specific health advice based on you as a person.
Yes.
But I think in the short term, that it's only available to people who are rich. So like people who have access to like the general health advice, that advice isn't even about them specifically. So we really need to make that accessible.
I like that you said that it would be nice to go toward a space where we can kind of have personalized care, right? And I think that's where we are moving toward. Like, everybody's different. Everybody's situation is different, which is why diverse research now, we really like to personalize things. And so that's why we have advocates that work personally with participants, one-on-one, get to understand their story, get to understand their health conditions and what's going on in their family. And then we can kind of talk from there and recommend different studies from there. I think that is definitely spot on, personalizing the health journey.
Yeah, I agree. It's super important.
That's what you're doing in your health and mindness coaching. Of course, each person comes to you. It's one person, and you're kind of personalize it based on what they present to you, right?
Yeah, exactly. There are like general things about like having enough energy. I think the biggest thing is having enough energy to do whatever you want to do. So you always have to think about your energy levels. But everyone has different like life purpose or things that motivate them. So I always start with what's your purpose, what's important to you. Then based on that, you're going to change whatever you're doing.
And I like that you're not just a health coach, but also you throw that mindset coach in there, because I think for sure they go hand in hand.
Yeah.
Health and mindset, like, it's all about like your mindset.
Yeah.
Tell me about that piece.
Like, yeah, definitely. Yeah. One thing I think about with mindset is your mind is the basis for everything you experience in life, and it decides all the contributions you can make to the world. So given that fact, it makes sense to train it. That's from a like mindfulness teacher. If you think about the world itself, you can't directly experience it. It's filtered through your mind. So if your mindset is not helpful to you, then you're not going to be able to achieve whatever your goals are. So it's kind of like it's a starting block to do really anything, but especially if you're working towards health goals or trying to find your purpose.
I think we also talked when we first met about like if you had been in any research studies. I think you had told me that you had done something.
Yeah, I've done a couple. So when I'm doing user experience design software, I'm administering studies. So I'm finding participants, talking to them, finding out what they need, and then designing software. So I've done both sides. I've done that a lot. And then I've also participated in research studies. I most recently did one for some Apple products. They're releasing, I think, some new stuff with spatial computing that uses like gestures for inputs instead of typing. You're just like making gestures with your hand. So they were wanting to test on different types of people with different heights, weights, different lengths of arm. So I did some testing with them. And then I've also done like some health testing for, I think this was back in college. Oh, for diet. Just like seeing how my diet affects, I think it was affecting my blood sugar. Yeah.
Oh, okay. That was a good one.
Yeah.
Would you ever recommend like clinical research studies to your clients?
Yeah, I'm going to be a biased answer because I do research, like I administer it and I take part in it. So obviously I'm going to say yes. But I think whenever you have the opportunity, if you're comfortable with the study, especially with health, like if you're a person of color and there's health studies around you, we need more of that data. So I would encourage you, even if you're not super interested, just think about helping people in the community because you're giving more data points of people like you. So I think that's super important. And then just outside of that, it's interesting to know things about yourself that you probably are not going to know. Like you might not have access to these machines, or like you probably are not going to take the diligence to set up a study on your own to see how something in your life is changing over time. So having that, it's kind of like you're getting paid to understand yourself more, which is also cool.
It is so true because when you are participating in a research study, you do find out a lot about yourself. We do share with the community like, hey, you're getting like extra testing done. Like they're doing labs, they're doing all this information you can use in your everyday health journey. It's definitely good, like that additional information that you can get on a consistent, regular basis. So it's super, super important. One of the things, the reason why we created this podcast is to share with pharma and biotechs and the people who are doing the research what the community is saying about research. So you have already said you understand why it's important for us to get involved. How can pharma, what can they do to encourage the community to get involved? I think the industry is now starting to understand, like, hey, we need to go out and to just talk to everyday people, which is why we also started this podcast. Yeah. We wanted to just talk to everyday people about research and get their understanding of it, their insights. So what would you say to pharma and those biotechs, those people that are doing the research on how to reach the community, the Black and brown communities? Yeah,
definitely. Let me make sure I understand the question. You mean like pharmaceutical companies that are developing drugs and stuff? Okay. Yeah, that's a pretty big topic. So I think the first thing I would say is some more needs to be done to build trust. And I'm not sure personally how to do this. I think communities of color have been harmed by the medical system in general and also as a side effect of pharma. So some sort of, I guess, outreach or trust building is needed. I feel like that's kind of foundational because it's hard to, even if you have good intentions, if people don't trust you, it's kind of hard to get them involved. So I think steps need to be taken to build trust. Maybe that's like inviting and or having decision makers in your organizations that are people of color. That maybe that's one way to build trust. And or like maybe the people that are running the studies are also people of color. So
that's another big one. That's another big one. Everything you're saying is what has been said in the industry and things that are important. So that's so funny that you're just saying that just right off your head. Like, you know that that's what's needed because it makes sense, right? It makes sense to have those people, that representation in the companies. Yeah. So if you want to get more people in the studies. So no, I think that pharma's coming around. I think that the work is being done. They're trying. I just hope that we can continue to move forward and do more and more because I think that we're kind of inching our way into the community. Of course, we're in the community consistently educating as many people as we can about why research is important, why diversity is important in the research, why we have to have a representation of everyone in research. It's super important because drugs are right now coming to market that are less effective in these communities, because they were not in the study. So that's one of our main points that we try to share with the community. So,
can I say one more thing about that? Yeah. I also think while you were talking, I was thinking about how to get more people in the studies as well. So obviously they have to trust you to be able for them to take part in the study. But also I think going to the community, maybe for research, is something that might be easier. With some studies, there's an expectation that you will come to wherever the place is. If a community typically has less resources, then that's going to be harder. So in order to, if you're truly trying to represent everyone, actually this wouldn't apply just to BIPOC, but it would apply to anyone that's less resources, which unfortunately is usually BIPOC people. Anyways, making it easier for them to participate by going to the community instead of having them come to you, I think is another way to get more people.
Exactly. That's another strategy that is huge in the industry that we're trying to do more of, is go to the community. So you got it. You understand. You definitely understand. So I have one last question because I know we'll end here. With your clients, your health coach clients, and I know you just started just now this year, is it about health education? Are you like educating them more so, or are you guiding them? What would you say mostly?
Yeah. When you say education versus guiding, is the difference there that education is just telling them information, or what's the difference in your...
The difference is that they don't know. You're like sharing with them things that they don't know and, to improve on their health, right? Or do they know?
Gotcha.
And you're kind of just guiding them to like understand like how to put things into place,
Yeah. Okay, definitely. I'm following you. Yeah, so I like to meet people where they at. Some people know like the basic things to do, and the main thing they need help on is accountability. Like, I know what I should be doing, I'm just not doing it. Some people don't like have an idea of what to do, so they're like curious. I don't even know how to start in this area. Then they also need guidance to help them execute. So I think it's a mixture. Some people like know what to do and they need accountability to do it. Some people are like unsure of what they could do. But what I do find interesting is that I always try to tell people to think of and connect with their inner best self, like the part of them that wants to make this change, that's moving towards that direction. And there's a lot of intuition where people will they'll pick up on small things when they pay attention to where they want to go and their best self. A lot of people have more knowledge that they were aware of. It's just they weren't paying attention specifically to here's where I want to go in my life. And when they start paying attention, some things they start intuitively knowing, oh, you know what, maybe I do need more sleep. Or some people, maybe I need to sleep less. I'm sleeping too long.
Being intentional. That's what came to my mind when you said that.
Mm-hmm.
Super important to be intentional when it comes to our health journeys, I think. So cool. So maybe one day you can come out to one of our events and do a talk, general health talk, or I don't know, I think that would be super important. We love to share as many resources in the community as possible when we have our events.
Yeah.
So the next one is February 27th, our next Chow and Chat. We have these monthly events in the community in City Heights where we bring it's from 6 to 8 in the evening. So it's after work. We did that intentionally to reach people who are maybe at work. We really want to bring the community out as a family, as a whole. Some of our events will be tailored to certain groups, but that event we really want to bring the whole family out. So that's why we have that event in the evening, maybe so people can get off work, come to the event. They can even bring their kids. We have a kids corner at the event, and just really continue to educate the community. That's what we do at that event. We feed them and we educate, and we share resources.
Yeah.
So you will be a huge resource in the community. Would love for you to come, and maybe do you have brochures, flyers of the work that you do?
Yeah, people can look me up on my website. It's justincampbelldesign.com.
Okay.
You can reach out to me there. You can email me. But I would love to help you guys out.
Yeah. I'll send you all the information about that event. It won't, with our first one in 2025 is February 27th. So I'll send you out that information. Yeah. But thank you so much for being here today. Yeah. I really appreciate it. And we'll see you maybe in the new year.
That sounds good. Thank you so much for inviting me.
Merry Christmas and Happy New Year.
Yeah, you too.
Thank you. Okay. Yeah.